The guide is based on the key stages that an organization goes through as it develops their plan for wellness. You'll notice that each stage represents an action, as it describes the key theme or activity. This user-friendly approach is based on wise practices and incorporates the voices of hundreds of First Nation health managers. There are 4 key benefits of this approach. By focusing on wellness, the approach is holistic and can be rooted in a community's own traditions.
The stages approach supports customized planning where communities can use their strengths and plan for those areas that need to be improved.
It helps newer organizations follow a process that is clearly laid out and leads to robust planning. And the approach is scalable, and it can be applied to small and large organizations. The purpose of using the 7Ds approach is to provide the structure that supports communities but doesn't prescribe exactly what to do or how to do it. The first stage is our first D, is discuss. The discuss stage looks at the readiness elements of health and wellness planning. Those elements that need to be in place to help your process move forward in a good way. As the first stage, it recognizes the will of the community to begin a planning process, prepares leadership, and creates a health and wellness planning group.
As the name suggests, discuss includes communicating to ensure leadership and community are informed and ready to be involved. The steps below will help ensure that you've got the fundamentals in place.
The 4 key steps are, first, engage with leadership. You need to have community leadership aware and supportive of your health and wellness planning. Each community has their own process for keeping leadership informed. It is assumed that you already have their support. For example, you have approval or a BCR for health and wellness planning. Do this right up front. By ensuring your leadership is aware of, supports, and is involved in your health planning process, you will help create champions in your leadership group. And every health planning process needs as many champions as it can get.
Second, establish a planning group. Create a planning group that represents different sectors and areas of expertise within your community. This will help ensure good guidance and a broad range of voices and will help make your planning process richer. This might be your health committee or your health board or another group assembled specifically to develop your health and wellness plan. Be clear on who this group reports to. Create a terms of reference that includes the mandate, membership, roles and responsibilities, timelines, and any specific community protocols. For example, policies on conflict of interest and confidentiality.
Third, communicate with community, stakeholders, and partners. Communication is a powerful thread that runs through the entire planning process. Remember that people need to know what is going on in order to support and be engaged. Get the word out there, let people know what's coming, and reinforce that this is a transparent process. Fourth, link with your comprehensive community plan, if your community has one. It's very important that your health planning process is aligned with your community planning process. What that means is that your health and wellness plan will support the priorities that may have already been determined. We know that the health of a community depends on more than health services. As such, it's important when developing your health plan to ensure that the process and the content are aligned with your comprehensive community plan. If your community doesn't have a comprehensive community plan, your health and wellness priorities can be integrated into the community plan at a later time.